From the News Channel 5 Network, this is OpenLine.
Good evening, everyone. I'm Rory Johnston, sitting in the OpenLine chair tonight, and we're so pleased you have joined us because it's a really important hour here on OpenLine on News Channel 5 Plus. We're going to talk all about the Affordable Health Care Act, specifically the window that's going to open up November 15th coming up it's going to be here before we know it, to re-enroll and also to enroll folks who don't have coverage yet under the Affordable Health Care Act. And so we want to welcome back a couple of familiar faces here who continue to come on and share their knowledge with us and help you to get enrolled. And that is Shrago and Mary Hunt. They're both from Get Covered Nashville. Welcome back. Good to have you here.
Thank you.
Time is ticking. It's hard to believe that we're, already mid-October, and yeah, it's just flown by. But I'm glad you're here because this kind of woke me up as I started looking at the notes here, realizing it is almost time for re-enrollment, year 2 now, on November 15th. So we want to urge our viewers, a great opportunity for you to call in and ask questions. It can be complicated. It can be a little intimidating if you go on the website to kind of get some information. So 737+, our phone lines are open if you would like to call in and ask a question of Jackie or Mary. My first question, although I said November 15th, how long is this period going to last this year?
It's going to be much shorter this year.
It is, yeah.
It's going to close February 15th.
Okay.
So it's about half the period of time we had last year.
Why is that?
Well, because ultimately they expect that as people get used to doing this, they'll realize it is a much shorter section. Right. And if you realize what people who have employer coverage get, they usually get about 6 weeks. So this is still twice as long. But the difference is people are not going to have all their income tax preparers saying, hey, have you done this yet? Right. Which is what we had last year. And that really helped for people to meet the deadline.
Right, because that pushed into the spring.
That pushed into the spring, and it's not going to be that long this year.
What is the number one question that you're receiving right now that you're kind of seeing come in from folks? Well, there are probably a wide variety.
I think there are a wide variety, don't you, Mary?
Yeah, I would say the main question is, do I need to get back on the site? Do I need to change anything? Can I keep my plan if I like it?
Right. And what are the answers to some of those?
Well, we're going to suggest that you be a good consumer. And being a good consumer means you look at it because there are going to be new carriers, new options available, and the rates will have changed. And so some that you might not have considered last year, these companies are being competitive, and so you'll begin to see new rates this year. So it is important that you take a serious look at that and see what does it mean for me and my family.
All right, 737+, if you would like to call in and ask a question. I want to run through some numbers that I found here about last year, and these are national numbers. Despite all of the news last year with the glitches and the website issues, there were missteps, of course. This is a huge rollout. More than 7.3 million people purchased health plans through new insurance marketplaces I have here. Nearly 8 million low-income people enrolled in Medicaid. And that brought the nation's uninsured rate down to its lowest level since 2008. So even despite the missteps, in the long run over the year, a lot of folks have said, hey, this is starting to work.
It's starting to work. We had expected 100,000 in Tennessee. We have 150,000 who signed up to get health coverage through the marketplace. And then in addition to that, there's something like another 100,000 or so that got Medicaid coverage that hadn't been covered before.
What are your goals this year here in Tennessee and in Nashville?
Oh, we think we should double that.
Really?
We think we should get all those people and about that many again.
Okay.
Yeah, there's still about 450,000 folks out there who are potentially eligible to sign up this year. So although we're really encouraged by what happened last year, there's still tons of room for more people to sign up and still a lot of folks to reach.
And there are unique challenges this year because last year a lot of the people who enrolled, maybe it was just maybe a little easier to reach them. And who had pre-existing conditions or whatnot.
They were waiting.
They were waiting.
Right.
They were waiting.
Now it's different. You have to reach out, at least for, well, obviously to the people who are already enrolled, to take a look at any changes, but also to get people out there to really get the word out and reach people who may have, for whatever reason, not enrolled last year?
Well, we do know some things about the people who didn't enroll. And there was some national research done comparing people who were not previously insured and comparing whether they got insured or whether they didn't. One of the things we know is that the people who still needed insurance actually want it. There was a lot of question, well, they really don't want it. That's not true. The research shows that overwhelmingly they do. Overwhelmingly, they also went to the website like 4.5 to 5 times and yet didn't get coverage.
Okay.
So that means they struggled with what to do and how to go about it, which is the reason we're here, because we represent organizations and means by which people can get one-to-one assistance. So we're going to...
And that assistance is out there.
It is indeed. And we have a better way of getting it across the state now. We had a lot of trouble. We had a lot of assistance in Nashville, but we didn't have as much assistance in the other counties across the Channel 5 viewing area, and we do now. And so we're going to be announcing an 800 number where people can call. And the only thing they do when they call is get an appointment at a day and a location and a time that's convenient to them. And so we're hoping that that will help them, because many of the people don't have good access to computers at home. People tell us that all the time, especially the people who are uninsured. So rather than trying to do it on their own,
elderly, lower income, rural areas.
Right. You know, if they have to go, 50 miles to find somebody, that's a pretty good distance.
Yeah.
So we think we'll be able to help them better, and by seeing where there are consumers who want our help, we'll also better be able to staff where we need to go. Get volunteers and qualified staff to help in both cases.
So this is something you think almost every year, with the research and with your own experience here locally, you're learning more and more, and it's just going to get easier and easier.
Yes, we do think it's going to get easier and easier. And we think it's going to take like 3 years. I mean, that's been the expectation all along, that it would take that long to get, and that's what's happened before. We keep comparing it to what happened in Massachusetts. And it took 3 years there for most people to get a sense of how to go about this.
So you're here tonight. How else are you reaching out? What other efforts are being made?
Well, we depend a lot on trusted partners. Trusted partners who talk. We want to be in the community where people are already going. So I don't know how many events we've done already, but we've done a lot of health fairs.
A lot of health fairs?
A lot of health fairs. A lot of public kinds of things where people go and in their communities.
In Nashville this summer, all the street festivals, like the East Nashville Tomato Festival, those types of gatherings, we always try to have a presence there.
When you have a presence, are they mostly volunteers working for you or staffed?
It depends.
A mix?
Over the summer, because our volunteers worked so hard towards the end of open enrollment, we kind of let everybody take a break, and it was mostly just staff coordinating those, but volunteers always play a really important role. And then we've also been gearing up for this next open enrollment period with the volunteers, just planning for this year. We have learned a lot from last year, and we're just all really excited to apply that knowledge to this open enrollment.
And again, remember, this open enrollment lasts only about 3 months, which is roughly
Actually,
half.
12 weeks.
Is it 12 weeks?
Yeah, it's 3 months, but it also
12 weeks,
includes all those holidays that we always celebrate.
Right.
So the time it will get to us so fast.
Rip by. Let's go to the phones before our first break. I want to get in Ann, who's called in. Hi, Ann. Welcome.
Hello.
Hi. Go ahead. What's on your mind?
Last year, I was unable to get coverage because I only worked part-time.
Okay.
And so I never made enough money even to cover any sort of premium. Would the new open enrollment allow me to get some sort of coverage under Medicaid?
Well, that's a question we're still facing. And at this stage, there's essentially 3 options. There is the marketplace, which has all the cost-sharing benefits, but that means you have to have a certain income to reach those. When the law was passed, of course, we thought everybody else who was under that income was going to get covered under Medicaid, but that didn't happen in states like Tennessee, where our governor and legislature decided not to expand Medicaid. So you can get Medicaid, but only if you are a parent or pregnant or have a disability. So as this lady is describing, Ann doesn't quite make enough money to get the tax credit, and we're still in that place in the middle. But at this point, our governor has said that he is working with the federal government to develop a plan to try to cover those folks. So we're still hopeful, but we will not have an answer to that by November 15th, I'm certain, because the legislature has to approve it.
Yeah, we have to wait till the next session.
That's
on
right.
that. Yeah,
That's
and
right.
the last word I think we've covered again. He's had conversations with
Right.
with the folks in Washington, and again,
Right.
we're just waiting to see what comes
that
of
looks
it.
like.
Right. How many states do we know
Well,
made the same decision as Tennessee not to expand?
It's about half the states.
Right.
So I believe
Let's
it's.
see, I think we're up to 30 states now that have gone with it.
Okay. And did that help you?
Well, it answers my question. It
Yeah.
really doesn't help me.
Right.
Thank
I
you.
understand.
Yeah.
Good luck to you, Ann. We appreciate
Okay,
it.
thank you.
Thank you for calling. With that, let's go ahead and take our first break. We've got a few more callers coming in, and we hope you'll join in the discussion as well. 737 plus as we continue Open Line on this Monday night. We'll be right back.